We're seeing absolutely terrible scenes in India at the moment. Effectively, the healthcare system has collapsed, which is why we're seeing people dying on the streets outside hospitals because they can't get oxygen support. It's why we're seeing oxygen canisters with police escorts trying to get them into hospitals. And we're seeing just these real scenes of desperation. Experts say it's kind of a perfect storm in India. It's a mixture of a new variant. Also, although India has given a lot of vaccinations, it's still only 10% of their population, which is not enough to stop a new wave of the virus. And then also there's an element of complacency, I think, which has happened in a lot of countries, but they sort of beat their first wave last year. And then in March this year, actually, their health minister said, we're in the end game of the pandemic. So after that, they had some big events, which were largely maskless, huge religious festivals, cricket matches and state elections, and that's all kind of could well have been super spreader events. We know a bit about the new variant. There's no evidence particularly about who it infects more or whether it is more deadly, but much like the British variant, which caused us so much trouble over Christmas this year, if something is more transmissible, that means there's lots more cases. That means there's lots more serious cases, which means there's lots more deaths, sadly. And it also means that the healthcare system comes under a lot more pressure, which then also leads to, more serious cases getting worse and again leading to more deaths. There's no data about children being affected more by this variant, but when you're in a place where an epidemic is out of control, like India, you're going to get more children infected just because you have more people infected. People have said to me, we didn't prepare while we could. While the going was good, we should have lined up, oxygen supplies. We should have lined up how to get them to hospitals. We should have thought out PPE. We should have really ramped up the vaccination campaign. And none of that was done. There were a lot of warnings that if that wasn't done, there would be this sort of awful tsunami of COVID, and that's what's happened. The Indian government is unlikely to impose a national lockdown because they did do that last year and it was very effective, but it also caused huge suffering, economic collapse, masses of hunger, lots of people out of work. So they've relied on local authorities to do that, and there are lots of local lockdowns in place now. People say that India just kind of has to ride this out a bit, try and keep each other safe, try and stay away from people, hope that they manage to kind of get the healthcare system under less pressure. I don't think vaccinations, even with a really quick ramp up, are going to make a difference in time to get over this, this particular wave. It might stop a third wave. I think it's fair to say that the UK was not that far away from this, the absolute worst of our own epidemic, when we also had more transmissible variant, huge numbers of cases, and January there were a lot of warnings that, the NHS was close to collapse. So we need to take from what's happening in India and think, we can't be complacent about this virus. We have done really well on vaccinations and that's brilliant, but, we need to really keep going with that. We need to keep going distancing, and I think we need to also think about how we can help India as a country in terms of getting aid out there. And then as an international community, I think we need to think about how we can help vaccination efforts to sort of prevent this happening again in India in a few months and also anywhere else in the world. As the WHO says all the time, unless everybody is vaccinated and protected, everybody remains vulnerable. It's a reminder the pandemic isn't over, even though in the UK things are going quite well with vaccinations. It's a reminder to keep an eye on variants coming into the country, which I think actually we're doing pretty well in the UK. It's also a reminder to keep an eye on the spread of variants to the neighbours of India, places like Nepal and Sri Lanka. And then it's also kind of a warning for the world that, we need to think about vaccinating everybody. India is known as the pharmacy of the world because it makes a lot of the vaccinations for the efforts to kind of get vaccines to poorer countries. And if that pharmacy of the world shuts its doors internationally because of the huge demand that there is in the country, that could have really far-reaching implications for lots of countries in places like Africa, which are already struggling to get vaccines.